25 minutes, share some information I put together, and really, I think we have about an hour. Is that right, Randy? Okay, so we'll, and the rest of the time is really to open it up for questions to see what kind of questions you all have. My goal is for this to be useful for you, so that's the metric of how I achieve that is based on your feedback. So I really appreciate, we do ask for some feedback as well at the end, and so I look forward to the opportunity to hear how you feel this helps at the end. All right, so let me just jump right in. Just a quick, some information about myself. I've been in practice, I've been out of training for 20 years. I did do some work as a medical director for primary care clinics for many of the Fortune 500 companies over 5 years. And probably the most, the thing that has given me the most insight into business is owning my own business, just like all of you. I've been owner of Los Gatos Doc for about 4 years, and that's taught me a lot. And the main thing I want to convey there is I feel your pain. I had to basically shut down my practice several weeks ago, and I've got several employees, and you know, it's I've been paying them, and my intent is to keep paying them because they're excellent at what they do. So I'm in a similar situation. So with that said, you know, our conversation today is about what to do, you know, what to think about when you're reopening your business, given what's going on with COVID. So just again, thank you to the Los Gatos Chamber and Campbell Chamber. And we did get some information. This is, I'm sure, not a comprehensive list of folks that are attending, but just wanted to thank you all for taking the time to talk today. And then I think this is just to kind of make sure it's clear that I'm not an expert on your business, and I'm just trying to give you some thoughts and a perspective to think about how to reopen. But certainly the primary guidance is from the state, the local, city, and county and state health departments, and CDC, of course. So nothing I say supersedes that. And let's go ahead and jump in. So the 3 things in the overview that I want to just share are, number 1, we have to really understand the public health strategy, and because that's what we have to practice in our own business. Because if we don't do that, then we're going to end up as a society and a community in a much worse situation. Each plan that is developed has to be unique, clear, and as comprehensive as we can make it. It's tailored to your business, so there's not going to be a one-size-fits-all. And the last thing is, it's really a marathon and not a sprint. I follow Dr. Anthony Fauci pretty closely. He's the one kind of public official in all of this that I listen to. My bias is that he's a physician, so I kind of expect him to have that medical perspective. So I think we're in this for the long haul, and this is not something where everything's going to go back to normal in the next few weeks. So with that said, let's jump into what we're talking about. Probably the main message in terms of public health safety is boxing the virus in. So what does that mean? We have to test a lot of people, and because that's the only way we know who's got it and who doesn't. And so that's coming online. It's still not where we want it to be. Once you test them and they have it, you want them to be isolated. If someone's infected, they have to be isolated. Then the next step is to find every person that person came in contact with. So I was talking to a patient of mine who is a business owner, and I was explaining that what this means is you have to know who interacts with your business at every time. Your employees, your customers, your vendors. So it's kind of a complex matrix, but you know, we need to know who that is, because you need to find all those people. I mean, the public health department has to find those people and tell everybody, look, there was someone who was infected, so everyone has to isolate to make sure that if you got exposed, that you don't pass it on. And that's where the quarantine comes in. So this is, from what I have seen, this is the underlying public health philosophy. So if you're in a situation where have a business or you're in the, you're interacting with the community, this is what you got to be aware of. And anything that we do to support this is going to make a big difference and is going to protect all of us in the long run. So these are the 10 steps. I'm going to go through them in some detail. Again, the goal here is to provide an overview, kind of create a framework for a plan. It's not a comprehensive plan. And I think using this 10-step process and adding details and having a strategy that works for your business will help you be successful and help our community be successful. So the first thing is, there's a lot of language about what to do, is it COVID safety, COVID, I think it's more COVID avoidance. We're not going to stop this 100%, but we need to act like we need to avoid it. And the first thing is basically assume everyone has a current active infection. What does that mean? So I need to act in a way that wherever I go, I don't want anyone, if I have it, I don't want anyone else to get it. And so that's why I wear a mask. If I go into a store or go into a situation where I need to have more closer contact with someone. So, and this is a really important point, I think, because if we do this, then we support the idea of boxing in the virus, because it has nowhere to go. Because if we all act like we might have it, and we don't want to give it to somebody else, it's got nowhere to go. The next point is social distancing at your business. And we'll have some other examples as we go through the slides, but you want to kind of make sure that your employees, to the extent that they can be apart from each other, your customers have space, your vendors have space, everybody's got to be, the goal is to have everyone be that 6 feet apart. And if you can't do it physically, like just being 6 feet apart, then you need to have barriers or other ways to prevent the virus from spread. Priority protection for high-risk employees. This one hits home to me because I have a lot of patients who come in, they're over 60, they might be immunocompromised, which means their immune system, maybe they have a history of cancer or something else going on. So these are all folks, and then I actually have an employee that's pregnant, or that was pregnant. And these are all folks that are higher risk. And so, what I try and do is, for example, I would, my pregnant employee, I've told her basically she could work from home. I don't want her to get sick, and I'm just trying to protect her. And that's just an example of kind of how we approach it. So again, it's a philosophy of COVID avoidance, and it's not going to be 100%, but if we all think that way, I think that makes a big difference. The next point is about having a plan to disinfect your business. So what does that mean? Well, on the left, you can see here, this is a graphic that highlights how long, it is from a paper from the Lancet, how long we think the virus will survive on what kind of products. So, you can kind of see the details here. So this translates into how much of a risk of transmission that you have. So, just as again, I'm a business just like I have my own business just like many of you do. So I would be I'm thinking about a deep cleaning weekly where everything gets cleaned. A regular cleaning daily where some of the more high flow areas and sensitive areas get cleaned. And then, probably what's the thing I would spend a little more time on in our conversation now is an employee workspace cleaning that could happen every 1 to 2 hours. I mean, in my case, it happens pretty much after every client comes and leaves. They're in an exam room. So, and in the back of our minds, we really have to be thinking, okay, what surfaces did they touch? And so something, for example, that might happen every 1 to 2 hours or less is cleaning the door handles, cleaning any seating areas, cleaning, looking at what are the, if you have a credit card terminal or something like that, and we'll again talk about that a little bit more. If you have something like that where customers come in to pay for their services, maybe that gets cleaned after every use. So, I would think of it, and I would think of it as a checklist that where you have everything that needs to be cleaned, and the things that you clean every 1 to 2 hours, they're more high flow areas, whereas the deep cleaning weekly, that's for everything. So your list for every 2 hours is much shorter, and the list for daily is a little longer, and weekly is even longer. So again, you know, it's how do we stop the spread, and that's where the disinfecting makes a big difference. The next example or the next step is monitoring your team. So you've taken care of the physical aspect of the business. Next is your employee team, and you know, keeping an eye on what's going on with their health. Well, this gets divided really into a couple of different areas. One example is around signs and symptoms. So, you know, having standardized temperature checks, and that's an example of that. The second area, and you see a screenshot here on the left, is having a questionnaire that talks about employee symptoms. So, you know, employee behaviors. So what does that mean? You know, have they tested positive? You know, do you know that information? Have they traveled anywhere? It's unlikely, but it's a question we want to ask. And really kind of giving them a chance to give you an idea if they're practicing social distancing. So, and of course, honesty is key here. If they are really rigorous at practicing it, that's great news. But if they're a little more lax or a lot more lax, then that can put things at risk, you know, for your other employees and for your customers and for your vendors. So, yeah, I mean, these are questions that we want to ask and ask everyone to answer as truthfully as possible, so you can kind of protect the community and protect your business and do what's right. So, and the last category is around what their exposure is. So, again, you know, what are the signs and symptoms? Their temperature, do they have any active symptoms like fever, cough, shortness of breath? And there's a little more detailed list. You know, and then questionnaires about their exposure or their behavior, which is an example I have. And then third is really about their exposure. So what are their interactions? Do they know anyone that tested positive? Are they interacting with the broader community? So again, you know, this is just a framework for monitoring your team. The next step number 4, is about minimizing interactions within your employees. So, you know, I think for the businesses that can support it, you know, continuing working from home if you don't need to be in the office, and you know, having alternate work schedules, and this is either alternating or just delegating people to work from home. And the third kind of discussion point is within your business, if you have people physically coming through the business, have a single direction flow. So the example I have for this is basically, you know, where I work, we do happen to have an employee and a patient entrance, but as long as if we don't have a lot of people coming in and out, patients could use the same door. But if we do, then we want to have an entrance, one way for them to enter and a different way for them to leave. And this avoids, again, the possibility of contact when they're crossing paths. So that's kind of what we're trying to avoid. And again, it's all about the overall theme of COVID avoidance. So, you know, it's another example of how you can achieve that. Step number 5. So this goes back to a point that we made at the beginning, which is understanding the box it in philosophy. And this is about supporting contact tracing. So if you look on the left, you see an example of basically describing what is contact tracing. And the first example is if you have no contact tracing. And it just is about how the virus spreads. If you have nothing, you can see that, you know, all of the red dots are kind of covered in the rightmost column on the top here. I don't know if you can see my mouse, my pointer, but that's that's with no intervention. If you can, you know, if you have some contact tracing in place where the first person who was infected isolates immediately, you know, you have some limitation or some slowing down of the spread. But what contact tracing really is that when you get the person who is infected and all of their immediate contacts, then you've kind of stopped the spread. So the last example is the most clear example of how successful contact tracing is when it works well. And the reason why that's important is, for us, is we need to know who the people are. So the first step is tracking your employees, knowing who's working when, which many of us do already. Tracking when a non-employee enters and leaves the business. So anyone who comes with, who's a customer or comes with the customer, or a group of customers, you need to know who all of them are, because that's how we know, that's how we can give that information and they can contact those folks. And the last piece of the puzzle here is collecting that information. So in my case, again, how that would change is I know when a patient's coming in because they check in. What I don't always clearly mark down is I don't always note, okay, well, who are all the family members that came in, And so that is what becomes important for me. And so the same way for you guys is for anyone in their business is that if you have multiple people coming in, it would be helpful to know who all those people are. Because if there's a problem, we want to get that information to all of them so that they all self-isolate and, again, control the virus. So step number 6, again, we're trying to continue with the philosophy of COVID avoidance. So you want to limit the contact interaction. You want to limit the contact interaction. So you want to think of contact-less interaction. So what does that mean? Contact-less ordering. Maybe, and I just said quote-unquote ordering because it depends on the kind of business that you have. But basically, whatever service or product that they want from you, they pay for it ahead of time, so that they're not pulling out the credit card, they're not doing that physical interaction that's needed for that. Contactless payment. So again, aside from choosing what they want, actually paying for those services. And I think what would be, even from a business perspective, what's good for all of us is that we collect the payment at the time that they order the service. So that part is done. And so, like, if they're ordering something online or they're deciding they want a service online or something like that, then we just collect that payment up front. The last is, and this is where, again, you have to have your own unique plan depending on what you do. If you're a winery, then how do you deliver the wine without interacting with the customer and in a safe way? So, I mean, part of it is, okay, well, you make the commitment to wipe down the wine bottle and at the time that you place it in the package. So, these are the challenges that you have to kind of think through and work through the details about that are unique to your business and to the services that you offer. Step number 7, communicate your plan. So it could be as simple as just having a whiteboard with clear instructions that say, okay, this is how, please sanitize your hands, please wear a mask, whatever it is that you have. And you need to communicate, you need to think about communicating that on your website, to your mailing list, in different settings so that you can reach your entire customer base.
I'm going to interrupt you for 1 second here. So you actually need to post your plan on the door of your business, and it's spelled out very clearly on the Santa Clara County Public Health site. So you have to do more than this. It's pretty detailed, and it needs to be posted. So, okay.
Yeah, thank you for that, Randy. And as I said in the beginning, I mean, the county and city, state, they're going to have very specific, or they may have very specific rules. And so I think that's what you need to follow. The adjunct I would say to that is that, I don't think any of our customers, or I think it can be challenging for the customers to read a plan like that. So we need to have something simple and easy for them to see. I mean, like the example I would give you is for a lot of my patients, there's, there's many of them where it would be great. I could continue to take care of them with the video visit, but there's many of them that don't even know how to do that. So I think we, again, the detailed plan that the county requires absolutely has to be followed. We have to have a way that our customers can easily understand that. And that's one of the challenges I think is still going to be there for us. And so just building out what you said, Randy, with what the county has said, we need to communicate the plan with the employees, with our customers, and then we need to use different tools. And once you have the detailed plan, we need to make it in a practical way. So we need to have signs. You might need to have markings. You might need, many businesses have gone in the direction of creating tape on the floor that says, okay, here's an example. If you're waiting in line for something, this is 6 feet apart from the person ahead of you. So, I think, all of those things can make a big difference. The next step is step number 8 is getting feedback on your plan. These are not set in stone. And again, whatever it is that the county and the city, state, they require, you're going to have to come up with practical ways to implement this. And so I think it's really important to ask your employees what works. Ask your customers, what is it that, what from a safety perspective they're looking for, or what's an inconvenience for them, and getting an idea from that perspective. And then, I didn't discuss this with Randy or Ken, but I think, having a forum like this, or even an online forum where we all talk about, this is what we're doing, this is what's working, this is what's not working. And, I think in the end, what we're trying to do is all be successful together. You don't have a single independent business succeeding completely on its own. Usually it's kind of a community. We all help each other, and that's how we succeed. So that would be one suggestion that I would have for us to consider, as members of the Los Gatos Chamber and the Campbell Chamber. The step number 9 is really, once you've got this and you've got feedback, how do you implement that feedback? You received it, you got to review it, and then you got to act on it. And it comes down to what's working, what isn't working, and what's missing. And one of the questions that I ask my own employees weekly when we have our meetings is, okay, what are the problems you're having, and how do we resolve them? And so, the question there is, how can things flow more smoothly? And so that's a fundamental question that we have. And so, we continually have to ask that question, because having a plan, I think, is a starting point. And as I said earlier, I think it's a marathon, not a sprint. Things are going to change. The county guidelines will evolve. The requirements will change. So we have to kind of keep looking at all of these moving pieces and see how we can improve the experience for our customers. The last step that I've identified is really about sharing your successes and challenges. And this builds off of what we talked about earlier, which was maybe a community forum with the chambers, talking about what works and what doesn't. But I think this is really important. And I think that you want to share with different groups. I've kind of highlighted sharing with your employees here, because I think that as stressful as it is for us as business owners, and for all of us in general, and for our customers because they can't access our services, I think that it's really stressful also for our employees, because they want to work and they can't. And so I think continuing to give them some encouragement, telling them how the business is doing, what's helping, what's not helping, and what the challenges are, so they can help us troubleshoot those things. So sharing with your employees, I think, is key. I think definitely sharing with your customers, saying, look, we've been open, here's what we've been doing, here's who we've been seeing, here's how things have been working. And then definitely with the community. And this builds off of what I said earlier, maybe using the Chambers of Commerce as a forum or meeting weekly or something to build on the success. So, I went a little bit over, but I wanted to leave the majority of the time for questions. And, again, this is kind of a summary of the steps that we talked about, and just reviewing, again, remembering we're supporting, we all need to support this box it in philosophy from a broad public health strategy. We're going to have to each develop a unique plan. It's not going to be something that is a one size fits all, and it's a marathon, not a sprint. So would love to get feedback. Here's a form that we could just, if you don't mind, and there's more form to give us any feedback. And if you want to receive a PDF copy of these slides with some other resources that I put together just as examples, here's a link for that, and we can share that with you. And these are some of the services that we provide in the clinic that we have. And I think that kind of covers the main content that we wanted to share. And I'm a little bit over the deadline that I set, but I really want to leave the rest of the time for questions, if that's okay, Randy. Okay.
Yeah, so I know you had some questions that people sent into you. Do you want to start with those, and then I can ask the questions that were on the chat?
Sure. I'm going to jump into the questions. The first question was, what are the key practices for safely serving guests upon reopening? And, let me just, give me one sec here. I just want to see what would be helpful is, give me 1 second here. I just want to, as I answer the question, I want to just take a look at what the businesses are. And this is not a comprehensive list of businesses that are currently involved. It was just the ones that we knew of. So I apologize if you're participating and you're not on the list. Oh, that's not what I wanted to do. 1 second.
Yeah, so there's all kinds of businesses. There's real estate agents, retail stores.
Right. So what are the key practices? I mean, I think that, so if you take, for example, now let's just take an example, a winery. So what are the key practices there? I think it goes back to some of the content I shared earlier where, okay, well, how is it, is there, the ideal thing is have a way for them to order the wine that they're looking for ahead of time, and be able, if you're serving, I mean, if you're delivering the wine, then, just have a process for them to order the wine and then deliver it in a contactless way. So basically they don't have to interact to get the wine that they're looking for. Now, if they're coming into your location and they're doing a, they're having wine there, then I think you need to have, the things I would think about are, for example, if you have outdoor seating or outdoor opportunities, to make that an option. And if you are inside, this is where I think many of you see in the news, where you're not serving every table, or you're not having, you're finding a way for your customers to be distant from each other, and also away from wherever they might be ordering the product, where they might be selecting the wine. So I think it just goes back to how do you, how do they find a way, how do you provide a way for your customers to order the product or the service and receive it without having that interaction or worry about getting exposed to a surface that might have the virus. And then, once you've done that, if once you have that, then the next step is, how can they if they're drinking wine or buying something, how can they keep their distance from other people in that process? So I think, it's how do they get what they need, and then how do they basically use that service? And so those are the two things to think about, and keeping the distance and the avoiding the transmission are the key steps with that. The second question we have here is, are gloves really better than frequent hand washing, given that exposed quickly, washing hands, gloves effective? So the most effective thing with regard to this is frequent hand washing. Gloves are not, we don't go to gloves first. So this is what I do in my own medical practice. I don't wear gloves between every visit. I wash my hands. So, and the challenge with gloves, quite frankly, and I've seen this, as a customer myself, when I go somewhere, I see someone, serving with a glove. And the problem is that, a lot of times they'll use that same glove to touch cash, and then they'll grab food and they'll serve it. And I think that essentially defeats the purpose of wearing gloves. Anytime you wear a glove, you really have to not touch, or you have to be very mindful of not touching any other surface. Because if you wear a glove and you touch your face, or you touch something like cash or something else, you're essentially what was intended to be something that didn't have a virus or have any source of infection, you're basically putting it on there. So I think gloves can be useful if you're very mindful of it, but the best thing is hand washing. And I've not seen any evidence that washing your hands with gloves on is helpful in any way. I don't think that is a common practice that we do in healthcare. It's not. So I wouldn't recommend that. The next question is plastic sneeze guards, masks, gloves recommended. So I think I talked about gloves already, so I'm not going to dig into that too much. I mean, I think, if you're wearing gloves for a specific purpose and you're very mindful of what you're touching, that's great. But if there isn't that diligence with the gloves, then I would just wash your hands. Plastic sneeze guards, I think that's a great idea. Many of the grocery stores have it. I think that you should definitely, if it's something that is needed for your type of business, where people need to come to the register to pay, I would definitely put that in place. I think that makes a lot of sense. It's a barrier. It's a great idea. Masks. So I think masks are a great idea. I just want to provide a little more detail here. So, when people think about masks, I think that there's a little bit of confusion there. There's a thought that we're wearing the masks. Some people think that we're wearing the masks to protect ourselves. The reality is, the whole drive for wearing the mask is, again, more in line with this COVID avoidance. It's the thinking that we need to treat everyone as if everyone is an asymptomatic carrier or asymptomatically infected. So the purpose of the mask is to prevent you from giving it to someone else. That's the purpose of the mask. So does a mask make sense? Wearing some kind of a barrier makes sense. I don't recommend wearing the loop masks that medical providers wear, or even wearing those N95 masks that people talk about. I mean, for the N95 mask, just to give folks some background, when I go to wear something like that, I go into the hospital, I have to be fitted for those masks, and they have to actually, spray a certain solution to see if I can smell it. So it's kind of an elaborate process. So I definitely wouldn't recommend that. I don't recommend the surgical masks. I do recommend wearing a bandana or some kind of physical barrier, because I think, again, the philosophy here is we're assuming that we all have it and we don't want to give it to somebody else. And so I think we kind of covered that.
And while we're on masks, someone actually had a good question.
Yeah.
So about the masks. So I think it was yesterday or the day before, the World Health Organization, their current position on masks is that there's no evidence that mask use of a healthy person is effective in preventing COVID-19. What are your thoughts on that recommendation that they just came out with?
I mean, I think, okay, so to get into a little more detail here, I think if you're outside and you're maintaining your social distancing, you don't need a mask. I mean, again, if the county or state or city, somebody comes in and says they want that, then that's a different story. But in general, I don't think you need that outside. To your specific question about what the World Health Organization is saying, I mean, I think that, some of this, we have to use our common sense in general and try and do what we can that makes sense. I think there's going to be a lot of back and forth on whether from different organizations about whether you do it or you don't. And there's also, when you talk about the World Health Organization, I mean, they're talking about, when they put something out, they're talking about globally, what should people be doing? And so that may not necessarily apply to, this specific location. So my thought is, if you're outside, you're social distancing, you don't need to wear a mask. If somebody's coming into your store or your place of business, I would tell them, or I would say you should wear a mask. You're going to be in a closed environment, and if I'm coming into your store and I sneeze, I could shoot that virus 3-4 feet, whatever ahead of me. So, and I can't control when I do that. And so I certainly shouldn't be coming in there if I'm sick. But even if I'm not sick, I've got allergies. If I'm an asymptomatic carrier and I sneeze, again, I'm spreading the virus dramatically. So I would definitely recommend that when your customers come in, that they wear masks. I think all your employees should wear masks. And one thought I had here was I was trying to go on one of those printing websites and see if I could get a mask with logos on it or something like that. And that was quickly, that idea was fairly quickly shot down by my staff. They weren't excited about giving out masks with logos, but I don't know. So what other questions do you have, Randy?
So one, privacy issues. So like, what are the privacy issues around like HIPAA things and just privacy in general about asking people when they come into your store about have they been sick, have they traveled, or all that, and their name and who they've been with? Can you talk to that a bit?
Yeah, so the questionnaire that I was talking about is really for your employees. It's not for your customers. I think, for your customers, I mean, I think it's within the health department guidance. Look, if they're sick, they shouldn't be coming in. And that's just a statement you need to put out there. And I would, again, I thank you, Randy, for sharing again that, the health department has their detailed list, but I would put that out there in a big sign. And I mean, I can just tell you that from my own side, I mean, part of the reason I closed down my practice is that I can't control that. I mean, people come to me because they're sick. So, I didn't want to be in a situation where even if I put it out on a sign and I say, look, please don't come in if you're sick, people will come in and I'll be talking to them and they'll be like, well, I was sick a few days ago. And then, all of a sudden it's like, well, what do we do? So I think we need to make sure the signs are clear and check with people often, but that questionnaire is not meant for customers. It's meant for employees. Maybe that's the point of clarification there.
Okay, except that in the tracing thing, you said that you want to know like who your customers have been in contact with. So really that was.
I mean, I think that so some of that is I think I think that situation becomes challenging when somebody's coming in and they're coming in with a group of people. Like if you're, for example, in restaurant dining, there's a group of people dining. Usually when people pay, I mean, I think part of that is you do collect information on who's paying, so you know who that is. So I think at that point, in terms of privacy and HIPAA, well, first of all, unless you're in the medical field, HIPAA doesn't apply to you. I mean, HIPAA applies to me because I collect a lot of sensitive information. I know allergies, I know medications, I know a lot of other things. And so I have an obligation to keep that safe. I think from your perspective as a business, I think that, you know, it is something where I think part of the communication is if, and it's a double-edged sword here, because you want more and more customers to come. So, I mean, I would love for a whole family to come in with my patients so that I talk to all of them, and at some point, maybe the rest of them become my patients. But in this day and age, in a way, you know, you want to kind of, if you're doing something where you want to kind of limit the interactions. But if you do have a group of people coming in, I think that, you know, you might be able to at least get their names and their phone numbers, you know, coming in together. I don't think that that puts you at risk for HIPAA, you know, HIPAA concerns in that situation at all, because unless you're a medical business, you're not, it's not a HIPAA issue. I think there are privacy issues with that. And so, you know, you do have to think about how you keep information private. And, but I think you also have a mechanism for that. You know, you can ask people to sign up for your newsletter, you know, or, and so that they're aware of what's going on. And maybe when they sign up, you know, you can ask a question of, well, did you come and visit our location to sign up, you know, and get some more information there? That might be a way to do it. And so, again, I mean, I think you do need to maintain privacy. You do that for your customers anyway. And so I think this is a way to kind of expand on that and also share that part of the reason you're doing it is from a public safety perspective, so you can notify them if something happens at your business or someone was exposed. So.
Will someone test positive if they are infected but asymptomatic, and are false positives or negatives more prevalent in asymptomatic people?
Great question. So just trying to think. This goes back to the box it in philosophy. So a couple things about testing. There's two main kinds of testing that are out there. One is basically the test of, you know, we think of it as PCR testing, or it's an example of his PCR testing is, do you have it now? And you know, that's the testing that everybody's been talking about, saying we need more, we need more, we need more. And that is the first corner of the box. You know, you got to test a lot of people. The second kind of testing is what's called antibody testing. And that testing is more of, did you have it? And, or actually not so much did you have it, but are you immune to it? I mean, are you quote unquote immune to it? Has your body developed, has your immune system developed antibodies to the virus? So going to the question that you mentioned, Randy, the direct answer is that people who are asymptomatic can certainly test positive with the immediate kind of testing, like the PCR testing. Ideally, we want to have so much of that available that we can test everybody and potentially test people multiple times, because that can change. And so that's how you know who's got it and who doesn't. And that's how, even if they didn't have it this week, you know, they might have it next week. So the challenges are, you can certainly get false positives, basically where they test positive, but they actually weren't, or even false negatives where they test negative, but they're actually positive. At this point, and it's getting better, but right now it's still a little more of the Wild West when it comes to testing, because there's just a lot of mistakes that happened in how the tests were deployed. And so it's a little bit all over the place. Some tests are really good and some others are not so good. And there's so many kinds of tests out there that it's even hard for me to clearly identify who's getting what testing and how accurate it is. So that's going to take some time to get standardized. Can you repeat the question? I think I answered it, but I just want to make sure I got it.
So the question is, will someone test, all right, you answered that part. Are false positives, negatives more prevalent in asymptomatic people?
I don't think we know that answer. I don't think we know if, it's more prevalent with asymptomatic folks.
Okay.
We're still getting our.
Okay, then I have one more question, and then click to your next slide because there's a question, a complicated question there. But this one, I'll just tell you. Do you have any suggestions for schools who will eventually be reopening their classrooms?
Yeah, I mean, again, for schools, I don't, with any of these questions, I'm providing some thoughts and guidance and all the things that go with the county and everything else. Please follow that. For schools, I mean, my kids are 10 and 8, so I'm very attuned to that situation. I think what I've heard and some of the things that I think are going to make sense are, continuing to do distance learning. I mean, that is here to stay. I don't think that's going to change. So, if you're a school, I would develop that heavily, figure out what works, what doesn't, build on that. Point number one. Point number two, I would start to develop a plan for, reopening. When you talk about reopening, I think you need to think about things creatively. Have half a class come 1 week, the next half the next week. Think of ways of doing that, because what you're trying to do is, number one, you're shrinking the number of students. Number two, and this applies actually to other businesses. Like if you're a restaurant or even a winery, or a, I think we had Caldwell Banker on, different services. Maybe you have different staff in the office every week. And the reason for that is that, if somebody gets exposed 1 week, first of all, you're dealing with smaller groups. But the second thing is, if somebody gets exposed 1 week and all those people have to quarantine or, get tested, you basically have a second group that's ready to come in and continue the service or being involved. And I think the same thing applies to students, is that if someone was exposed 1 week, you have some time to test and trace and figure things out. So the following week, you have a different group that's coming in. And so, that group is kind of protected. And you also are continuing to provide education and services and things like that. So I think alternating weeks is something to think about. And I think the third thing is, finding ways to do things in creative ways to do things in small groups. And, with the weather being better, I mean, you might be able to, that's the other thing for schools, doing things outside. I think that can make a big difference. And, using tools to keep, and in many ways, it defeats the purpose of being in school, where kids are not right next to each other interacting, but thinking of ways where there's a mix. Maybe there's some time that they're interacting closely, but there's also a lot of time that they're working individually or in small groups or pairs. Anything that you can do to mitigate the interactions. You want me to go to my next slide?
I do, yes.
Okay. 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 So I see why you wanted me to look at the slide. So different groups to make arrangements for, like children's or seniors, assistant place.
Well, I can answer the updated information. So the County of Santa Clara Public Health site, it has the most up-to-date information. And so that is the place that you should go. And then as far as the formula for determining how many people can be in one place at one time, I'm pretty sure that the county is also going to come out with a formula for that. I think San Mateo County already has, for like retail businesses, come out with a formula. I haven't seen one yet for Santa Clara, but you can be assured there will be one. I'm pretty sure it'll be square footage,
Yeah.
person. So at any rate, you can answer the other questions.
Great. I would just add for this formula for determining how many people can be in one space and room at a time, I would, obviously you should go with whatever the county is saying. I mean, you have to follow at a minimum whatever the county is saying. I think that as hard as it's going to be, like in my practice, I probably wouldn't start seeing patients. I mean, I was normally seeing 20 patients a day in the office, at least 20 to 25, but I probably would, I wouldn't see more than 1 an hour, just because you have to get the flow down. You want to figure out what the challenges are, give yourself some time. So you have to kind of build that up. So that would be, regardless of what the formula, I think you have to follow the formula at a minimum, but I would probably start slower than what the formula recommends and then ramp up to that. That would be one addition I would have there. And then obviously you answered the question about where to get updated information. So are there different groups that we need to make arrangements for, like children and seniors? I think that, many organizations have been doing that, in terms of saying their seniors hour. I think that that's a good practice in general. Saying that we're going to restrict this time for seniors or people with health conditions. I think, though, that the thing to be mindful there is that, you still have to follow some of these other things, which is social distancing and everything else. Because just because that they're in that age group doesn't mean that they are uniformly practicing social distancing or protecting themselves. I mean, I can tell you this from people from my own patients, I have many that are very careful and some that aren't so careful. And so I think the challenge with this is, yes, it would make sense to protect those groups and delegate certain times, but you still have to follow all of the best practices, maintaining the distance and wearing a face mask and all those things, because they're not all uniform in terms of their risk of exposure and risk of spreading virus. The children, I think that's a very challenging group. Until the last several weeks, I think that the thinking has been that, they're not at risk for any serious infections. And again, by far and away, most of them aren't, but there's some extreme cases that are coming up in the news now where they can get really sick. So, I think what I've heard is some organizations have said, okay, the older children who can understand what social distancing is and maintain that distance and follow those rules, those folks, maybe you start with releasing some of the restrictions for them, and as long as they continue to follow the rules, that's good. The younger children, I think it's really hard to try and convey to them the importance of some of these responsibilities. So I think, yes, you should make arrangements for children, and it probably can vary based on the age of the children, but it's still a kind of a challenging space that's still evolving. Going to some of the other things you had here, is there anything in particular nonprofits should consider? So I definitely think that, for nonprofits, you can do some of the things where you have different times for seniors who have the highest risk, seniors and people with multiple health conditions. I think that does make sense. And again, in terms of the children and other age groups, I think you need to kind of keep I think that the comment I would have there is build on what I said earlier. For the ages of children and for people of the other ages that follow the guidelines, you can continue to provide services and find ways to provide services. But I don't think you can do a one-size-fits-all, and I certainly don't think you can just open the doors at one time. I think you talked about the formula, added some thoughts on that. And the last question is it legal to ask these screening questions to your employees? I know, I'm asking my employees those questions. I have not formally checked with council. I am, I certainly would need to follow up and do that. But part of it is that to me, it's common sense. And I think we're trying to support the broader public good. So I would have to follow up on that question. But I am asking my employees that question, and the reason is because I have to, in order to protect my patients, my customers, because a lot of them are coming in because they're sick, and a lot of them are high risk. They have all these health issues. So from a practical sense, I don't know how I couldn't ask it. So.
Okay, and then the last question I have, 2 questions, and it relates to contact tracing, is it
Okay.
better to collect phone numbers or emails? And can we ask individuals to notify us if their testing changes after they've visited our place of business?
Phone numbers, emails. I mean, I think, I think that you need to treat their information with the same privacy, respect for privacy that you treat all your customers. So I definitely think, okay, having an email would be great. Phone number, email, name, first name, last name. I think at a minimum, taking information like that for your own customer pool makes sense. Your second question, I don't know the legality of asking them that question, to come back and tell you if they test positive. Certainly if there's someone that and they're a regular customer, they probably would do that anyway, but I think that if they test positive, I think then it goes into the public health arena. Public health department will step in and they will start to track down where they've been. And hopefully they can share that information. And when the contact tracers go into this, it's basically like an episode. I mean, I would envision that to be basically something like CSI. They start looking down, well, where did you go? Who did you see? And if they're going to spend some time saying, okay, what businesses did you go to? And if they know they came to your business, then they'll come to your business and say, well, this person was here. And it's going to be really helpful for you to know when that person was there, because then all the people who were around at that time, you can give all that information to the public health department and let them take it from there.
Okay, so that's it for the questions, and we're right at 11 o'clock. So thank you so much. This was very helpful. And yeah, so thank you all for coming.
Randy, can I just say something real quick?
Sure.
Yeah, on behalf of the Campbell Chamber, Dr. Fee, thank you very much for your time and the service to the community. Appreciate all the great information. It's hard because the information is constantly changing.
Right.
I did want to make everybody aware on the call, and Randy, I'll share this with you too. We're going to be hosting another webinar next week with Bozzuto Insurance and a company called Insight that's really going to look at businesses developing a exposure control plan and understanding the risk management strategies of opening. As the county starts to move towards reopening, businesses are going to have these in place. So we're going to offer that webinar next Friday with specific information about creating a plan, including checklists and protocols you can follow. So look for that invitation. We'll share that with you, Randy, so you can get it out to your chamber as well.
Great. Thank you all. Again, thank you, Randy and Ken. And it would really be helpful if you guys can share any feedback about how the presentation went. I really hope it's helpful. That was my goal.
Well, it was. Thank you very much.
Thank you.
Okay, thanks everybody.